I'd like to welcome everybody here for our first ever webinar presented to you by Highform Australia. I hope you're there. Erin, are you there?
Yes, I'm here.
Okay, good to go. I think we've got a lot of people attending tonight, so we're really grateful that you've taken the time out to do this. So just very briefly, the webinar is about the thing about ulcers, and my co-host tonight is Erin Romanen, who is a clinical nutritionist, and I'm a equine nutritional therapist and medical herbalist. And just for your interest, I guess, is that we are both also human health practitioners. So, of course, we have the ability to provide you with advice for yourself as well. So we're going to get rolling along. Okay, so with ulcers in horses, approximately 1 in 3 horses have ulcers. In this webinar, we hope to give you the information behind the contributing factors, why has it become so common, and what can you do to prevent ulcers from occurring in the first place. Ulcers can occur with any breed, any type of horse. It doesn't matter whether it's a gelding, mare, colt, filly, makes no difference. The risks will vary quite considerably depending on the circumstances. And ulcers can be related to different, I guess, attributes such as training, nutrition, changes in feeding practice, and even being stable for long periods of time. But most importantly, as far as ulcers are concerned and from a nutrition standpoint, is we often look at the importance, of course, of feeding a horse a very high roughage diet. And that is the key to really helping to reduce the risk of ulcers in horses. There's a lot of scientific evidence available these days to support ways to prevent ulcers from occurring in the first place. And a few of those will be, of course, creating an environment that is going to support a healthy gut microbiome. And that's probably one of the most important aspects. In a future webinar, we will actually be talking about the gut microbiome and really concentrating on the benefits of actually supporting it and how it's connected to not just digestive health, but also to the gut-brain axis, immune function, skin condition, and obviously with the gut-brain axis that comes into play with anxiety and stress. And ultimately, of course, it leads to conditions such as laminitis and the worst case scenario, colic, which as we know is quite common in horses. But today we're going to be talking about preventing ulcers, how to manage them, and also how to actually look at supporting horses that perhaps have a history of ulcers or being diagnosed with ulcers previously. So what are the signs of ulcers? I suppose it's a difficult one. We often describe a horse that's in pain as a pain face, as the diagram would suggest. Of course, if there is pain in a horse, then these types of, I guess, pain face attributes will occur. But very often horses with ulcers do demonstrate this. So there's actually a lowering of the ears and a separation of, or there's a distance between the ears. There's a contraction of the muscle above the eye. There's quite a tense facial muscle or facial muscles. There's, as we call it, a tense stare. The nostrils tend to be dilated. And this is it's quite significant in how horses react to pain in general. But in ulcers in particular, this is quite a common pain face is quite common in horses that actually do have ulcers. And as we go further in, we're going to discover how common they are too. So equine gastric ulcers are associated with the ulceration of the esophageal, gastric, and duodenal mucosa. There are some signs, other signs that may indicate to you as horse owners that your horse possibly could be suffering ulcers, and that can be a poor appetite, which is quite common. So not really terribly keen about eating their food, which is not normal for a horse. So, horses really, if you put a feed in front of a horse that is suitable for the species, they're not going to turn it down. If they turn it down, there's got to be a reason for that. So loss of weight is another one, a change in skin and coat condition. So the coat cannot be healthy, shiny, for example. Most prominent one is generally behavior. And particularly in performance horses, you might find the common one is horses, particularly say dressage horses or eventing horses, not wanting to go forward, so not wanting to go off the leg. Of course, the worst case scenario is colic. So actually learning to read the horse's body language is really important in ascertaining whether the pain face is related to ulcers. But even if there is this going on, then of course it's a time then to start to think about, well, what is causing it? Why is my horse upset? Why is my horse looking like this? The only way to diagnose a gastric ulcer is by gastroscopy, and this has to be performed by a veterinarian. There's no other way around that. This involves, as I'm sure most of you horse owners know, passing a flexible instrument through the nostril and actually examining the stomach. I'm going to actually just hand you over to Erin. You won't see Erin yet, but you will see her a little bit later in the presentation. I'm just going to pass her over to the next part of this presentation regarding basically conventional treatment for ulcers. Thanks, Erin.
That's right. So I guess as most of you would know, if your horse has experienced ulcers, or if you've undergone vet treatment for ulcers or the likes, the most common medicine that is used is omeprazole. Now, I guess the aim of this medicine is to reduce the amount of gastric acid in the stomach. So the way it does this is it blocks the last stage of gastric acid production in the stomach. And so it indirectly helps the healing of the ulcer because it does stop the gastric acid from damaging the lining if there's no feed present in the stomach. So I guess it does help, but at the same time, it doesn't really get to the cause of the ulcer in the first place, which is what we'll be looking at a bit more today, more of, I guess, a holistic approach to preventing ulcers and I guess their management as well. So most people use omeprazole with their horses just a few times or maybe once just to help the healing. However, unfortunately, some horses are recommended it long term, and there is quite a bit of an issue with this as it can cause malnutrition. This is because obviously it reduces the gastric acid produced, and gastric acid is actually required for the digestion and absorption of vitamins and minerals for the horse. So, yeah, I guess there's a little bit of a problem there if we're doing that long term. But yeah, that's what we're here to help you with today, just to get a bit more of a rounded idea of how we can help the horses with this. Anyway, I will pass you back to Antoinette.
Thank you, Erin. That's great. Okay, so let's now look at the percentage of horses that are diagnosed with horses, and we'll have some facts and figures and reference points after this. So at the moment, roughly about 30 to 50% of foals may actually have ulcers, and that's a pretty high level when you consider really it's astronomical. And approximately 90% of horses over the age of 2 that actually are showing symptoms of ulcers may actually have them. On the other hand, there are situations, as I'm sure you probably appreciate, the pain threshold varies with humans and with animals, and sometimes horses may have no outward signs whatsoever, but they still have ulcers. So the estimation is that approximately 50% of mature horses may have ulcers. That's a pretty high level as far as we're concerned. And the question is, why is this the case? What is the reasoning behind the high level of ulcers being diagnosed, particularly obviously gastric ulcers? Studies have been conducted mostly in performance horses and especially in racing and harness racing horses, and they've determined that it's very likely that as much as 80% or more actually have ulcers or actually have been diagnosed with ulcers, which is quite frightening if you think about it. I think just here at this point too, I'd mention that the feeding of horses has really changed quite dramatically over, maybe 40 or 50 years to what it used to be. For those of you who can remember that, I can, as a child. So here's some research which is supported research, and it's an American research report, but it doesn't really matter because it's obviously very relevant to pretty much anywhere in the world and obviously in Australia. But when we look at the performance type, endurance off-season up to, or 48% and up to 93% for competition season, Western performance horses around 40%, English performance, which, you know, would include, of course, eventing, show jumping, showing, dressage, etc., anything like that, about 60%. Horses that are pleasure horses, around 53%, and for the racing, thoroughbreds and standardbreds, between 58 and 88%, which is really, really high. I'm sure you would all agree with that. So what other risk factors are there when it comes to nutrition and the occurrence of ulcers? Well, ulcers develop very often because there's been quite dramatic changes in the type of feed that's being fed to the horse. And also the environmental impact can really be quite relevant here, in the sense that if, say, you move your horse to a new agistment property, or a new paddock, for example, or another horse comes to the property, you know, stress is another important part of this too. So environment really does have a major impact. We also know that the size of the feed is really important to be aware of, because horses have very small stomachs. In actual fact, I'm sure all of you, particularly at the moment, with for all of you that are in Victoria, in stage 4 in Melbourne Metro, which is where we are located, although we're on the peninsula, but obviously if you're in regional Victoria, it's not as bad, but it's had a fairly major impact on the state. So I think importantly, you know, we probably are very mindful of shopping bags these days, because you know, that's probably, as far as I'm concerned, that's kind of, you know, the major outing at the moment is going to the supermarket. So if you imagine the size of a Safeway or Woolworths or Coles shopping bag, that actually is the size of an average 500 kilo weight horse's stomach. So, you know, it's very small. So feeding small feeds more often is much more beneficial. We know that horses are their natural environment, of course, is that they are grazing animals, that they do really well if they're out on pasture and, of course, consuming small amounts of roughage. And we also know that if we change this, that we are also going to change the landscape of the digestive system. So we're trying to encourage to keep it as natural and as normal as possible to support horses that may perhaps be more, I guess, well, the risk of developing horses, for sure. Horses do need to chew, they need to masticate. With horses are quite unique to the species. They have a very unique way of chewing and grinding their feed with a scissor jaw action, but it is very important for them to actually develop saliva, so the enzymatic action, and stimulates the glands at the point of the mouth with that chewing and grinding. And that saliva, of course, then begins the process of breaking down the food, and it also lubricates the food to allow it to be more easily swallowed by the horse. So on this point here, when we're talking about feeding and the point of the mouth, we also know that if a horse is fed a feed, for example, that is too wet or soggy, that it will not encourage the horse to chew and masticate the feed efficiently. So therefore, it will actually not stimulate the glands as effectively, and therefore will not produce sufficient saliva. So this is going to cause a problem, particularly for digestive health. So what happens when feed arrives in the stomach? Well, once the feed arrives in the stomach, it causes a release of enzymes and acids, which include hydrochloric acid. And hydrochloric acid actually helps to break down the food into individual nutrients such as vitamins and minerals, which are essential for the horse's health and well-being. However, this process does continue even when there is no food available. So it can create a significant problem, because if there is an extended period of time where the horse is not consuming feed, then that can actually contribute to a formation of ulcers. And it actually can exacerbate the situation quite significantly. It can create a major issue there, for sure. As I'm sure everyone who owns a horse knows, that because they're perpetual grazing animals, they generally graze for at least 18 hours per day. And they don't normally go without food for more than, say, 2 to 4 hours, maybe slightly longer. They rest, generally speaking, very early, or statistically very early in the hours of the morning, so really early. And the feeds that are necessary for these horses really need to be a high roughage diet. And one of those roughage forms is alfalfa or lucerne, which has been shown to actually support or act as a buffer alongside of saliva, the development of saliva. So, alfalfa often gets a little bit, I guess, misunderstood. It's one of my most favourite as a nutritionist because its nutritional value is amazing, but to have a lot of scientific data behind the use of alfalfa and actually reducing the risk of ulcers is quite significant. And you get all that nutrition as well. So by actually acting as a buffer, it protects the stomach's mucosal lining from hydrochloric acid, which can create an unhealthy atmosphere if, obviously, if the stomach is empty for a period of time, and then in turn can cause ulcers. So as mentioned above, we know that hydrochloric acid is essential for the breakdown and absorption of nutrients in the feed, but it may pose a problem if, for example, there is a build-up due to no feed in the stomach, and that's pretty important for sure. Now, horses, I think everyone knows horses don't have gallbladders. So unlike us, where we can store the bile, there is actually a consistent flow of bile into the small intestine and hindgut with horses. So if there's no feed present in the hindgut, then there's going to be a build-up of bile. And that's really due to a lack of, preferably, obviously, feed or roughage. And for an extended period of time, it can actually damage the mucosal lining. If it's left too long, then it may precipitate hindgut ulcers. Now, at the moment, we don't have a definitive test for hindgut ulcers, so a lot of it is really performed by, excuse the pun, but a gut feeling and an understanding of what is going on with the horse. If there is pain, for example, are there any other symptoms, as we've mentioned previously? So horses actually have a continuous flow of gastric acid secretion. On the right-hand side there, we've just provided a daily feed and roughage guideline. Now, these are only guidelines because if you have a horse like mine who puts on weight very easily, you have to also look at being in a position where I don't have a lot of pasture, where you can provide plenty of roughage to the horse. But obviously, in the case of a horse like mine, provide the nutrition without, of course, stacking on the weight. And there are lots of things that you can do to achieve that goal. So if you're looking at a horse around the weight of mine, around say 600 plus kilos, then the average roughage that we recommend is about 6 to 9 kilos per day, and in total 10 to 15 kilos per day. Now, that 10 to 15 kilos per day relates to the whole amount of feed that you're providing the horse. So quite simply, it means that this incorporates if you're feeding a hard feed, if you're feeding plenty of hay, and also if your horse is out on pasture. So it's everything that you feed your horse relates to that 12 to 15 kilos per day. Obviously, depending on the body weight, of course, that level will come down considerably. Okay, oops, I just jumped ahead, sorry. Okay, this is where, it's the first time I've used this system, so hopefully it's working all right. So I've mentioned through this how important roughage is, and oh, I'm sorry, my little fellow's moving. And roughage is absolutely vital for horses. When you look at, say, purchasing a bag of feed, for example, if you're a horse owner that likes to know what is contained in your bag of feed, which I think is very important. It's a bit like when you go to the supermarket, you like to know exactly what's contained in whatever you're purchasing. It doesn't matter what it is, you'd like to know, like a bread, freshly baked bread, whatever. So when you go to look at a commercial bag of feed, you might see in the specifications that 50% is termed as roughage or fibre. But the problem is that a lot of the roughage or fibre contained in that bag of feed is not derived from hay, it's rather derived from byproducts, and byproducts are certainly not a natural source for the horse. So this is something, again, that it's great to either ask the manufacturer for more information, but also really study what is going to be the most ideal feed for your horse in that regard. So a hay-based feed is really perfect. So something that contains really good levels of alfalfa or oaten hay is a really good option for horse owners, particularly to achieve that roughage goal. So natural roughage is absolutely essential. So that can be in the form of hays or pasture, and this is going to really help to manage the long-term health and well-being of your horse's digestive system. So I'm actually going to hand you over to Erin now. Hopefully this is going to work, and we're going to let Erin continue. So let's get on with it and see how we go. Okay.
Alrighty. Hello, everyone. Okay. So let's go to the next slide.
It's up there.
Yeah, it's just taking its time.
Yeah.
There we go.
Slow.
All right. So Antoinette's already gone through a nice rundown of the equine digestive system. So I guess, yeah, from doing a bit of study, we found a German study on horses who were fed long stem hay, and they were actually less likely to develop ulcers than horses that were fed a combination of chaff and molasses. So I guess as a nutritionist, I find this really interesting, given the negative impact sugar has on the human microbiome and the digestive system that's been well studied. However, this hasn't been studied in horses, obviously, because there's a lack of funding in that area. But yeah, I found it just really interesting that this study found, yeah, that link, and that, yeah, the results really do open up a potential for extrapolating the data from human studies into horses. Yeah, as it is quite well understood that refined sugars can alter the digestive microbiome, which can create inflammation, and which we do know inflammation does create ulcers in the digestive system as well. Okay, so there are many aspects of a horse's diet that can influence the potential for ulcers to occur, as we have already discussed. Um, and there are different aspects of the diet that can do this as well. So, one area we'll be looking at today is starch. So, although starch is a crucial part of the horse's diet, it's really important that it's not overfed, especially to horses at higher risk. So, high levels of starch, as we know, commonly come from grains such as oats, wheat, barley, and corn. Oats being the ideal source of starch, as they have a really great starch to fibre ratio. So, this means they can be easier to digest for the horse, and they can also be fed whole. Now, starch is also a great source of digestible energy. However, some studies have shown that feeding more than 2 grams per kilo of body weight can actually increase the risk of ulcers. So just being mindful, I guess, how much you are feeding when yeah, when feeding grains. All right, so cereal grains are also quite low in calcium and other potential buffering agents that may contribute to the risk of ulcers. So, this is why we don't generally recommend corn as a good option for horses, as it can be quite difficult for them to digest and utilize in the body. And this is generally because it is Obviously, it's high in starch, but it is also very low in fibre. And if fed in high quantities, it can cause lactic acid buildup and promotion of a more acidic pH, which can increase the risk of ulcers because then again it does increase the inflammation and it affects the microbiome as well. So I'm going to go into a bit more, I guess, specific things about feeding for prevention of ulcers. And as we know, feeding a horse should be simple. There's no reason for it to be complicated. And that's the same with feeding a horse that has had ulcers, that um, has recurring ulcers, or that's never even had ulcers in the past. So there are different ways in which we can alter the diet to reduce the development of ulcers. So ensuring the horse's access to food and water is obviously essential. Every horse owner knows this, but it also does mean that having access to either 24/7 round bale or good pasture as roughage is the key to prevention here. So this may even be in the use of a slow feeder hay net to mimic natural grazing patterns when pasture is really low or unavailable. And this is also really effective in the case of horses who need restriction from lush pastures. So horses who are quite good doers in that case. Even on that, like it is commonly thought that horses with higher metabolisms are more prone to developing ulcers when this is very, very untrue. And heavier horses and horses with slower metabolisms, they can quite easily get ulcers just as much as their, I guess, skinnier counterparts. um, this is commonly due to one of the symptoms of ulcers being weight loss. And that is a common, very common symptom. However, it's not always in all cases. So, with this in mind, heavier breeds should still be fed a way in which it is natural for the horse and a way in which it reduces the chance of ulcers occurring. So, with this said, the consistency in which they're fed should remain the same. However, or as they are a grazing animal, as we know. However, it's more the type of feed that they're fed and the nutrient density that should change. So, if we opt for more low sugar pastures and hay rather than, I guess, your usual grass hays or, um, yeah, really high sugar grass pastures, that is more ideal. So, in these situations, you may even look at getting a feed test done for hay or even on your pasture as well. So we find that is yeah, is a really good idea as well. Just ahead to so oh, we have skipped a bit too far. There we go. Sorry, I'm still learning how to use this system too. um, so feeding horses with ulcers is similar in the way that we take into consideration that a horse is a horse. However, it does have a little bit of a different twist to it. So we are taking into consideration that the horse is being treated by a vet in this scenario, but there are several things that we can do to support that through their diet and support their recovery. So during this time of recovery, it is recommended that the horse isn't fed any grains due to the starch content that we discussed earlier. And it is recommended that they're kept to a very simple hay, chaff, grass diet. Um, yeah, grains in general are not usually recommended, also because they are a bit harder for the horse to digest. And obviously, if you have something that's hard for a horse to digest while it's trying to heal its digestive system, it can just prolong the process a little more. So another really important point that Antoinette brought up earlier was hard feeding. So a lot smaller meals per day, so maybe 3 or 4 smaller meals per day is recommended over 1 to 2. And this is alongside ad-lib access to hay and pasture. So this just obviously supports the horse as a natural grazing animal, but it also limits the feed quantity at one given time. So it reduces the, like I said before, the load on the digestive system and the amount that the digestive system has to work in one sitting. So feeding a horse with a history of ulcers. So, yeah, I guess this is quite common for a lot of people, given the statistics that the amount of horses that have or do experience ulcers. So, this is very similar to feeding for prevention and takes into consideration all of the measures that we have discussed before. But we do also have, I guess, the understanding now that the horse's digestive system has already been inflamed and it has already been injured in the past. So it's, yeah, I guess just super important to look at, I guess, a more anti-inflammatory approach to the diet. So this being what is natural for a horse to consume. So just eliminating any byproducts or waste products or fillers that don't really need to be in the feed or the horse doesn't really need to eat per se when there are better options out there. So another big point is avoiding moldy or rancid feeds. This needs to be avoided at all costs. And I know this is a bit of a common sense thing. However, it can sometimes go a little bit overlooked. Um, as we have established, the horse's digestive system is very, very sensitive and obviously should only be fed what it's evolved to eat. So, yeah, making sure that I guess their feed is always fresh will have the least impact on their digestive system. So another really good point is obviously we know that they're grazing animals. However, if it's been a few hours since your horse has eaten, it is recommended to give them a small amount of hay before riding or training. So this is because the roughage in the hay actually provides a fibrous layer between the lining of the stomach and the gastric acid. So it actually protects against any ulcers from occurring. Or protects against any damage from the gastric acid that could occur while you're riding around and that's sloshing around in the stomach. Yeah, and also studies have also found that lucerne hay could be more beneficial, and this is because it naturally has a higher protein content and calcium content. So both of these together can provide an extra buffering action on the gastric acid, which is really interesting. Um, Other things that we also do need to take into consideration with horses who have had a history of ulcers is potential either probiotics or anti-inflammatory formulas that can assist in maintaining the health of the microbiome as well as the digestive system as a whole. So again, going back to the fact that we know the horse's digestive system has been inflamed and injured in the past, we want to make sure that that inflammation is at the lowest point it can be and that continues throughout the horse's life. So yeah, this goes in hand with proper feeding practices. But yeah, I'll pass you over to Antoinette, and she can go through all the different ways that we can supplement this in our horses.
Okay, thank you so much, Erin. That was awesome. I hope everyone's enjoying this so far. I just would like to mention too, if you have any questions that you would like to ask, please feel free to do so. And what we'll try and do at the end of the presentation is to answer as many as we can. Those that we can't answer, we will then, we have your email contact, so we will then email you as much information as we can. Obviously, we are limited a little bit with time. But please feel free to do that, and we're more than happy. But we were quite overwhelmed with a number of of you registering, we had a cap of 200, and we actually we went over 200. So they've actually allowed some extra in, which was pretty nice of them. Okay, so what is the best supplement for ulcers and the gut microbiome? So, to be honest, a symbiotic, which is defined as a mixture of pro and prebiotics. I keep trying to work out which camera to look at. And this actually is, or has been proven to be beneficial, because it actually affects the host by improving the survival and activity of beneficial microorganisms in the gut. Studies conducted on the relationship of the microbiota of human gut and animal gut and immunology have highlighted the role of symbiotics in the health of animals. So there's definitely really strong evidence to suggest that it can improve or influence the microbial population of the intestines of humans and animals, which is really fascinating. I mean, we do, both Erin and I, find the gut microbiome is, I don't know, I'm a bit obsessed about it, but it is just amazing the more we learn about the gut microbiome. And I will just touch on a couple of things regarding bacteria too. So most of these studies have been dealing with symbiotics to actually prove that there is an improvement in beneficial bacteria. And then, of course, there's a reduction of the potential pathogen load. So that means that, we're reducing the risk of actually creating unhealthy gut microbiome. Now, I'm sure you've probably heard or been told that there's good and bad bacteria. And again, when we have our webinar on the gut microbiome in the future, we will obviously talk in great detail about the gut microbiome. But that actual, I guess, definition of good and bad bacteria is really not correct. It's very much outdated. It's not relevant anymore, because it is not really about the good or bad bacteria. What it is about is actually the balance of bacteria contained in the gut microbiome and how it supports the digestive or the health of the digestive system. And as I mentioned briefly, and really so many other aspects of the equine health. So we do know, for example, Firmicutes and Bacteroidetes are two of the bacteria that are the most prevalent within the gut microbiome when we look at studies. And Firmicutes is actually very much involved in the intake of roughage, for example. So it's very much associated with roughage, or the roughage component. When we look at horses, of course, that's a real key factor in the health and well-being. So the gut microbiome is something that's that we really need to look at supporting very efficiently. Now, supporting the gut microbiome, as mentioned in the slide before, symbiotics can be of enormous benefit. And there are a lot of digestive health products in the marketplace, and I'm sure everyone's very aware of that. Obviously, in our particular case, we don't discuss other brands. What we can do is recommend products that will really support the gut microbiome and overall health of the digestive health in general. So we tend to always recommend a product that has very strong science behind it, is palatable to the horse, because that's important. And again, if we go back to very early on in the presentation, I mentioned that part of those symptoms will be obviously loss of appetite. So you really want a product that is going to be very palatable, and hopefully that will work quite quickly and be very effective. And the other thing is a low dose, because again, you want to have a small amount going into the feed, not 150 grams, for example. Also, choosing a product that maybe is more oral grade for human consumption. That's always my go-to. And I think it's very important to look at that as being a really positive objective to looking at a product to use within the treatment and management of ulcers. So in the case of our product, which is BioEquus, it is a symbiotic. It is a pro and prebiotic, but it also contains gut-soothing herbs. And one of those herbs is an aloe vera 200-to-1 extract. And there was a study done, it's probably a few years ago, that Adelaide University did, and I actually spoke to the vet who was the head of that study, and they showed the benefits of actually using aloe vera in or actually alongside of omeprazole. And they proved that aloe vera as providing was an extract, very powerful extract, was quite effective and had, I guess, not a similar effect, but that it had enormous benefits in relieving the symptoms of ulcers. So we use aloe vera. We also use peppermint extract, vitamin C and zinc in the formulation. On a side note, I take it. My husband takes it. My dogs are on it. My cat's on it, and my horse is on it. So that's pretty cool. Okay, so that's our presentation. I'm going to just have a look here. I've got what's going on there. Okay. Wow. Okay. All right. We've got a lot of questions here, so I'm not quite sure where to start. Okay, I've got one here from Jane. Hi, Jane. Can a horse with ulcers self-resolve without medical intervention if the stressor reason is removed, i.e. after a long-distance journey or stabled horse being allowed to turn out 24/7? Erin, would you like to answer that question? Erin?
Yeah, sorry. My mic was just not working for a
Oh,
second.
that's okay. Did you, can you see that, or do you want me to repeat that? You can see that?
No, that's okay. I can see that. So I guess this is a bit hard for us to say definitely it can resolve or it won't resolve, Jane, just because we're not vets. So we can't, I guess, make that make that call. However, look, personally, I think it could definitely reduce the severity of the ulcer if the stressor is removed. So yeah, it would definitely help. But then again, it depends what grade the ulcer is, how long it's been happening for. If there's multiple ulcers, there's a lot more things that come into play, unfortunately, with that question. What do you think, Antoinette?
Yeah, look, I think obviously, again, like Erin said, it does depend on the severity of the lesions, and yes, of course, how many lesions there are. And I think, because we're not veterinarians, but of course, we always look at a holistic nutritional approach. And I think very importantly that if there is medical intervention required, then I feel, again, you don't want to bypass veterinary treatment if it is required, but certainly we can have a major impact on like going forward with changing the diet. And again, it depends on, what you're currently feeding the horse as well. So, it won't really resolve on its own necessarily, I think. I think we need to address the situation if we can. So if that answers, and Jane, also, you're very welcome to contact us if you want us to have a look at your horse's individual diets, for example. So from Fiona, what are your thoughts on feeding lupins rolled, as always thought they were a superfood for horses? Okay, so in a nutshell, and I'm sure that Erin will have the same opinion here. Look, lupins really are not an ideal feed for horses. They are, again, not what we would term as a natural feed for a horse. So I think very importantly, it would be important to be mindful of the fact that if we're providing a horse with a good balanced diet that has a very high level of roughage, and certainly with performance horses, definitely, we can look at the inclusion of, say, some oats, for example. We're great fans of oats because, as Erin mentioned, you can feed them whole. So digestibility of lupins is not, as a nutritionist, is not at the top of our list. What are your thoughts there, Erin?
Yeah, I would say similar. Look, it's not my preference, as I think there are a lot better options out there. But like Antoinette said before, if you do want a bit more direction and I guess a more individualized approach on what would be better or better suited for your horse, then you're always welcome to contact us.
I've just Kim Fitzgerald has just mentioned there's some questions in the chat, so we'll also have a look at that too. Just looking at the time. Okay. So Carolyn, would you like to look at that one, Erin?
Yeah. So, has there been any studies on the impact of worming pastes on gut health in this regard, and how long the impact may last? I really love these questions. Actually, I just want to
So do I.
say they're really good.
They're awesome.
Yeah. Look, honestly, Carolyn, not that I have seen specifically on the effects of ulcers in itself. There have been a few different studies on the impact of worming paste on gut health, just in general. And obviously, yeah, generally negatively impacting the gut health, but that is quite short lived given worming paste is not
Mm.
every single day. So that's all that I've seen. But Antoinette may have read a bit more into this. I'm not sure.
Yeah, I mean, there has been some, sort of reasonable studies on the effects of worming paste on the health of the gut. Certainly, I think my thoughts there are is to be, I guess, mindful of the fact that if you can integrate some natural form of worming, and there is, there are natural forms of worming that we can suggest to you, for example, that you can maybe integrate in between using the worming paste. I think also the other problem that we're finding now with worming paste, and this has been very well documented, is that the ability to actually be effective, or the effectiveness of paste, is waning considerably. So I think this is where we need to maybe look at other ways of, objectively looking at other ways of supporting the gut health as far as worming is concerned. Obviously, worming horses and maintaining this is exceptionally important, very important. But I do think that there are things that we can do in between those, 6-week, 8-week worming programs. Some are pushed out to more than that. Yeah. I really like this one here, Kalia. Has there been any documented cases of trauma from pain associated with ulcers? Horses still displaying symptoms from muscle memory even after the horse is scope clear. Well, I think this is a great question. I hope I pronounced your name correctly, Kalia. Look, I believe 100% that horses, I always think, horses have got quite reasonable memories. And I think that as far as pain is concerned, because it's a very common problem, and definitely pain is very significant in the case of ulcers, if we hark back to the pain face with horses. And we can imagine ourselves, when we're in pain, how it actually impacts on us long term. And I think, again, we're very mindful of that, and we have muscle memory as well. So I really believe it's not unusual at all for a horse for this to happen. And I've heard this a lot with horses who've been diagnosed with ulcers and then have been scope clear. So to me, I think, it comes down to looking again maybe at the diet, just to ensure that everything is right there. And then maybe look at perhaps looking at some natural pain relief or something like that going forward. And even if there is nervousness or tension involved, perhaps looking at targeting a diet that would support a horse in that regard as well. What are your thoughts on that, Erin?
Yeah, look, I agree. I think another also important point is, yeah, as obviously you've said, there is a lot of pain associated with ulcers, and some horses this may be prolonged for months and months on end, and it can almost become like a post-traumatic stress kind of situation after the horse is healed as well. So there sometimes can be a lot of behavioural issues, or not even issues, but just I guess an emotional trauma that needs to be worked through for the horse. So I think that's also really important to take into consideration is, like you said, even if the horse has been scoped and it's clear, there can still be that horse's actual memory of the pain, and doing up a girth and all that used to hurt me, maybe it still will, kind of situation. So yeah,
Mm.
I think there's a lot more. Yeah, there's a lot more at play with pain, especially.
Okay, I'm just going to have a look in the chat because someone very kindly mentioned there were questions in there. Okay, okay, so we've got one there, right? So, hi, do you recommend cubes over pellets when feeding a forage-based diet? Okay. Well, that's an interesting one. So I presume, Molly, that you're referring to hay cubes, for example, over, say, pellets. Again, I think it will depend entirely on the type of pellet that you're looking at. There are some really good. I'm not quite sure where you are. I know we've got some international people here too on the webinar tonight. So if you're looking at, say, your hay cubes, very importantly, I would recommend that you look at hay cubes that are not too big. So maybe like more of a 9 millimeter or 6 millimeter size would be really good. I'm not a fan of those really big ones because I think they can be an issue as far as the horse digesting and utilising it efficiently. Over pellets, again, it is really relevant as to which type of pellet that you may be referring to. So if, for example, it was a commercial feed pellet, again, as I mentioned, often those ones do not contain hay-based roughage, so they're more byproduct-based roughage. And look, if we look at the stock feed industry, there's probably around about 100 different types of byproducts available in the market, in the stock feed market in general, and of that, there's quite a high percentage that are used in horse feeds. And look, as a formulator myself, it's very easy, to look at specifications, and there's no doubt that byproducts contain, energy, protein, roughage, but unfortunately, it's not the right form. So yeah, so Molly, if you are interested further, I would invite you to certainly contact us, and we can maybe help you a bit more with a diet in that regard. Erin, did you want to answer Montana's, is meadow hay okay for a horse with ulcers? I can't seem to get loosened hay anywhere.
Yeah, absolutely. Look, well, I guess does depend what is contained in the meadow hay, but generally speaking, that's one of the good options. I just try to steer clear of wheaten hay, and yeah, maybe oaten hay as well, just for the time that the horse is healing from the ulcer. But look, meadow hay is perfectly fine.
Yeah. Okay, Meredith has asked thoughts on copra meal. Okay, copra is a byproduct, and I think very importantly, it needs to be soaked. And as I mentioned previously, when you are feeding a horse, it's really important to ensure, of course, that the diet contains that high roughage component. And also, I guess our recommendations is when you're preparing a hard feed, for example, that you feed it damp bordering on dry. So really the preference is more towards dry than damp. Copra, of course, when you feed it, because it is wet, it expands considerably. It does not encourage that normal chewing and grinding process, and it is not a natural feed substance for the equine. So as nutritionists, both Erin and I are quite strong on that. We don't agree with feeding copra to horses. You'd agree with that, Erin?
Yeah, absolutely. Yep.
Okay. Right. So yeah, okay, I'm just going to jump through a bit. So yeah, actually, someone here, Lenny, she's has done some research on worming and the gut microbiome. And yes, 2 weeks for the microbiome to heal after worming makes complete sense to me. So I would say probably in a lot of cases, depending on the horse and the metabolism of the horse and the situation, the type of feed, etc., it may actually well be a lot longer than 2 weeks. What are your thoughts on slippery elm or lecithin? Okay, so I'll just mention slippery elm first and lecithin. Both are really quite beneficial for gut health. Again, I like to think about the synergistic effect of a group of nutrients working together. So my preference is not to actually feed, one or two ingredients, but rather look at, I guess, a group of nutrients that will actually have a really positive effect. But those two, we use slippery elm bark extract in our BioEquus. So those two are definitely quite effective when it comes to the supporting the digestive health, and certainly can be quite beneficial in conjunction with other forms of treatment for ulcers. Okay, so beet pulp, again, have a similar problem, but I'll let Erin talk about that one because I talked about copra, so you can talk about beet pulp. We have touched on lupin, so yeah.
Yeah, so beet pulp, well, similar to copra meal. Again, it is a byproduct, and there is, I guess, a lot more beneficial things that we can be using in the horse's diet that are more natural for a horse to consume. And similar again to copra, it does need to be soaked before it's fed. So it does compromise the horse's digestive system in that way as well, as we discussed earlier about obviously horses needing long stem fibers to be able to chew and grind properly to produce the proper gastric acids and enzymes to help to digest the food, and that is not really possible with a soaked or soup like in some
Yeah,
cases feed.
yeah.
Yeah.
Okay, so wind sucking a cause or a symptom? It's an interesting question, Carolyn. Wind sucking, interestingly enough, generally speaking, we think about horses, they are creatures of habit. Generally speaking, wind sucking is a learnt behaviour. That's quite common. But there is no doubt that where there is pain attached, that possibly the wind sucking can, of course, then expand to a more serious condition and could then be a causative factor with ulcers. Probably not necessarily determined as a symptom, but certainly there's no doubt that it could certainly have an impact on the severity. There's no doubt. Would you agree with that, Erin?
Yeah, definitely. I've seen quite a few different studies that have, yeah, shown wind sucking to, I guess, affect the gut microbiome itself. So even that, it has that effect. It can, yeah, therefore increase inflammation or change the actual environment of the gut. I'm sure it could, yeah, can also be a risk factor for ulcers too.
Now, everyone out there, I'm not totally sure when we get to our hour whether they cut us off or whether we can keep going. So if they do cut us off, we will definitely try to get back to everybody who we haven't answered questions. They just keep coming. So okay, Vanessa, just regarding vets recommending long-term use of meds such as Ulcer Shield, etc. Okay, this frustrates me, but I don't know what my other options are when the ulcers return despite low stress environment, natural feed, pasture, etc. How long is too long on these meds, and how can we challenge this theory with the vets in the best interest of the horse? Okay, well that's a really interesting one. Um, as we've mentioned, look, we know that omeprazole, of course, is effective in suppressing and helping to heal. There's no doubt that it does. But long-term use definitely can be an issue, as it is in the case with human health. We know that omeprazole is also a common ingredient, or it's a common drug that is used with human ulcers. So long-term use, I think, my recommendations there would be probably no more than a couple of weeks. And then really seriously getting down and looking at a truly natural feed. I know you've mentioned the natural feed and lowering stress, etc. But it might just be worthwhile looking at some preventative measures, some natural preventative measures that you might find work really effectively for this particular horse. So I definitely would consider that as being an option. And look, I think, we would have started a study on ulcers and the gut microbiome with, in partnership with Smart DNA, who are genetic scientists. But unfortunately, COVID put an end to that. So that is definitely on the agenda. As to when we can do that, we're really not too sure. So unfortunately. This may sound strange from Belinda, but I've heard of people using Yakult in horses' feed to help with ulcers due to it containing a probiotic. Okay. Yes, yogurt. That's a common recommendation, definitely, because it does contain probiotics. But as a treatment, it's probably not very effective at all. So I think you'd agree with that, Erin. It's probably a nice, uh, a nice thing to feed to assist with gut health. But to be honest, it's probably not going to be very effective in that regard.
Yeah, I'd agree. I'd also just be mindful, I guess, of the point of yogurts and those kind of products are from a cow, and horses are strict herbivores. So I guess there's a bit of a conflict of interest there. I know they do contain probiotics, which is great, and it's actually wonderful for our health as people. But just with horses, it's a little different. It's better to feed the probiotic itself, rather than in, I guess, a solution that has milk product.
Yeah. Erin, would you like to answer Decima's question there?
Yes. Is it presumed that if a horse doesn't present with ulcers in their gut, that they then wouldn't have them in their hind gut? Look, this is more of a vet question. However, I don't think you should make the assumption that if they're scoped and you don't see anything in their stomach, that there isn't anything in their hind gut, because a lot of horses do present um, like that, I guess, and they do develop ulcers in their hind gut and not their stomach. So I wouldn't rule it out completely. Yeah, but then just talking to your vet about what their opinions are. Obviously, each horse is so different. It's hard for us to say. But yeah, that's just my take on it. What would you say, Antoinette?
Yeah, look, I mean, I think absolutely I would agree with that entirely. We know that as far as diagnosing hindgut ulcers, it's really difficult to ascertain, and a lot of that is, as I mentioned, it's trying to use I guess your own knowledge and watching the horse's body language. But yeah, I would agree with that entirely, absolutely. Um, Wow, they just keep coming. Okay. All right. This is amazing. And this is fantastic, everyone. You're just incredible because these questions are really great. They're fabulous. So you've obviously really been thinking about it. Carlia, would adding stalks of loosened hay to soaked feeds help counteract the impacts brought on by lack of chewing action? I find beet pulp is ideal for hiding dusty gut supplements in. I love it. Okay. Look, no, I think very importantly, you really want to move away from soaked feeds altogether, because again, even adding in some loosened hay or loosened stalks or hay stalks isn't going to really counteract that, because the majority of the feed is still going to be quite wet. So that is going to limit that normal chewing and grinding action. I think very importantly, when it comes down to using something like beet pulp to hide supplements in, I think again it's probably very relevant here. A is what type of supplement are you using, and B, there are some really great ways to ensure that horses will consume the dusty gut supplements. I think that's great. Without any issues whatsoever. So I think it's just about, again, I think in your case, Carlia, like everybody here, you're very welcome to contact us, and we can certainly look at preparing a fee program. Look, we're offering this service at no charge, so we're very happy to help you. That's what we do. We love what we do, so we're very pleased to be helping any of you. Would you want to have a look at Bridget Murphy's
Yeah,
question?
sure.
Yeah.
So Bridget asks if there are any tips or suggestions for managing an ulcer-prone horse who is in work but also needs to lose weight, wanting to protect the gut and provide all the nutrients, but also maintain a healthy weight to prevent laminitis. Yeah, look, there's definitely um, quite a few different things that we can work on here. So I guess we'd need to take into account, sorry, if the horse does have energy when it's working as well, because that's a big factor. Obviously, we want to make sure it has the energy to work, so it can lose the weight as well. That sounds a bit backwards now that I think about it. Um, but yeah, we can definitely do that. So, supporting a horse who is a bit overweight and needing to lose a few kilos, we can look at things like teff hay. A lucerne based feed as well is very beneficial. And then obviously we'd need to supplement, like you said, the horse needs to get all its nutrients every day. So looking at a daily supplement would be the best option for this horse. And then also making sure that they have a really good, just general anti inflammatory supplement to prevent laminitis occurring, as well as, I guess, you could use that supplement as a two-in-one, really, to protect the gut as well as preventing, yeah, the occurrence of laminitis. But look, Bridget, if you want to send us an email, I can give you a bit of a better, more individual idea on your horse. Yeah, and yeah, probably get a good diet for him.
Yeah, absolutely. I think that's a really good suggestion there. And I know that I know just personally with my own horse, as I mentioned, he's a very good doer, as Erin knows. And I was really struggling with weight on the horse, and even as a nutritionist, I was finding it very frustrating because he actually was carrying about 120 kilos more than he should. He's a big horse, but it was too much. So it is really easy to regulate the diet, and I've got him back to perfect body weight without it being too dramatic either. So it's no different to a human losing weight really quickly. That's not a healthy way to do it. So yeah, absolutely, Bridget, we can certainly help you with that. Brenda, I fed soaked barley and just started mixing soaked lupins for advice, mixed with lucerne and oat char. Horses on the paddock with natural pasture. Am I wrong with this? I'm struggling with one mare. She slipped a foal 3 months early this season. Okay, so once again, Brenda, soaking barley or soaking anything is not recommended. So what I think I would suggest again would be to look at a very simple, balanced diet. I'm not sure again where you're located. There is a very good feed called Harry's Choice, which is the only one that actually is a true hay-based feed, and it's a pelletized feed. And there are no byproducts contained in that one. That might be a really good option for you. And there's lots of there's 5 different feeds. You really don't need more than 5 different types of feeds, in my opinion. So something like that would be really good. And obviously, again, depending on what are these all mares that you're supporting, for example. So I would again absolutely invite you to contact us, and if you've got clearly more than one horse, so definitely we can help you out there and set you in the right direction. And that also means looking at assisting with your mare that you're struggling with condition. Again, when it's the other way around, there's really great safe ways to increase weight. Again, your alfalfa, inclusion of alfalfa or lucerne is really vital here. And feeding hay, lucerne hay, would be great because again, it's encouraging that normal process, also supporting the digestive system and digestive health with that great buffering action. But really excellent in protein, great calcium, great nutrient content. It's kind of it is one of my most favorite ones, definitely. So we can certainly help you there, Brenda. If you're very welcome to contact us. Mandy Graham. Okay, so natural preventions for ulcers, please, as my horse is on her second round of Ulcer Shield and has only cleared up to 2/3 of her ulcers. Wow. Okay, so Mandy, again, I think it's looking at something like our bioequals would be really, really great. But very importantly, it is, I guess, paramount to look at the horse's diet to make sure you've got a really good level of roughage for this horse. And of course, it's going to vary with the type of horse, the workload, etc., as to what you would be feeding the horse. But definitely, look, this is not an unusual comment that we're hearing from you, Mandy. It's quite common. I think very importantly, when you are looking at using omeprazole in whichever product, I mean, they all contain it, that it does suppress the ulcers. And so very often when you stop using it, it's not actually really clearing it up efficiently enough. So that's where I think you need to put some preventative measures into place. So, Mandy, I would say definitely feel free to contact us, and, we're more than happy to help you in that respect. Kostya, do you want to answer that one, Erin?
Yep. Where are we? Thoughts on replacing some hay with straw for overweight horses? Does it have an impact on ulceration? Um, does it have an impact on ulceration? I'd be inclined to say I wouldn't think it would have an impact on ulceration, given it is a type of roughage. However, I would not recommend straw to be fed to any horse. It is, I guess, in Australia we use it more as a bedding, and I personally don't really know any horse that would eat straw. Well, there are so many better options out there, especially for overweight horses. Sticking to something like a teff hay or a lucerne hay, as we discussed earlier, has so many more nutritional benefits as well, without stacking on the extra kilos for the horse as well. So keeping in mind, the horse may be overweight, but at the same time, it still needs all the vitamins and minerals day to day that every other horse does as
Yeah.
well. So just
Yeah.
making sure the sugar is really low and the starch is really low in your hay, and that should be a bit better than feeding straw.
Yeah, absolutely. I agree with that. Definitely, we don't recommend to feed straw to horses if you can possibly avoid it. There's much better options available. And again, I'm not sure where you're located. So also now someone has asked about contacting us. So Erin has popped the email addresses there. If not, when we go through all these questions, I believe we do have your email contact, so we can certainly follow up with more information as well, and obviously see if you want some assistance. Mandy Graham, she's due to be scoped again in a couple of weeks for the third time. Okay, so she's been rested since May, really struggling with this. So again, Mandy, I think very importantly, we need to look at getting the diet right and trying to solve that as an issue. I'm just going to hop across because we're going to have to close this, and I'm just going to hop across, okay, and see. We have some more questions here. Okay, we answered some of those up there, so I'm just, whoops. I'm not sure where we were because there's that many. That's been done. Okay. Are there any signs which could indicate poor gut health by looking at manure? Do you want to answer that one, Erin? Because that's a pretty exciting one.
I think you're best at answering this.
Okay.
Your love.
Okay, so looking at manure, it tells, the picture tells 1,000 words. Absolutely, manure can indicate so many things. We like to suggest that a healthy manure or healthy feces is one that when it's basically like a kidney shape, and when it hits the ground, it very gently falls apart. There is no smell. In other words, horse manure, horse feces really should not have a bad smell. It should not have a sour smell. There should not be any mucus or liquid, so no diarrhea. So a healthy feces will certainly indicate good gut health. And that's a pretty good key to follow, is those kidney shapes. When it hits the ground, it gently falls apart. No smell, no mucus, no water, no liquid. So that's probably a really good indicator overall, for a healthy horse too. If there are some issues with the horse's feces, then, you need to look at the reasons why that's happening. Okay. So just here, Kim has asked, for the questions you don't get to, will you email all participants with the question and response? Yes, we definitely will. It will probably take a little bit of time. Okay, and we just do these last couple, then we're going to have to close. So just from Jane, thank you, Antoine and Erin. Was just out of interest, as many horses have ulcers and don't get scoped. So just wondered if the body could recover without omeprazole, if the reason for developing the ulcers was removed. Thanks for the response. Okay, I have an underweight, highly strung Arab, and he has had ulcers in the past. These have been treated now, but needing to get him to put on weight. He has access to free choice grass, round bale and loosen hay, but isn't gaining weight very well. I think in this case, Robin, because we're going to have to close now, we've kind of gone about 45 minutes over. So I definitely will certainly respond to everybody. But if you specifically would like to contact us, you definitely can. So that's not going to be a problem. You can even jump on the website and grab the email from there too. But we will definitely reply to all your questions. So please do not think that we will miss you, because we won't. We've just got a lot of questions here, and we really just kind of can't answer those today. But yeah, if you can be a little bit patient with us, because it might take a little bit of time to get to you, because there's a lot that we haven't even got to. So I just want to thank you so much, because we were absolutely overwhelmed and really rapt about the fact that you know, you have responded in this way, and you have that much interest in helping your horse's health and well-being. And we're really excited that this is the first of many webinars, and we hope that you will all join us next time. And in the meantime, stay safe, stay well if you're in Victoria. Let's hope that these case numbers keep dropping dramatically, and we can, you know, go back to, or part way back to, some kind of normality. Okay, thank you. And thank you so much, Erin. Again, been fantastic, been really enjoyable working with you tonight.
Yeah, likewise, and all the questions were amazing as well. So thank you to everyone who came and watched.
Thank you so much. We'll see you on the next webinar, and just keep an eye out for the dates, because we will be putting those up in the next, probably, I say, 5 working days. There'll be the next webinar coming up. And also, please, if you have any suggestions, feel free to email us and ask us, you know, if there's a topic that you would like us to talk about. We are more than happy to look at that for you. Thanks again. Good night.